India is witnessing an acceleration of development, and undoubtedly the future prosperity of the country is linked to the health of the nation, its people. The cross-country endeavor of NFHS 1 and 2 has been to collect vital information about the health needs and aspirations of women.
Coordinated by the International Institute for Population Sciences, 13 organizations collected data for NFHS 2. Among the world's largest health surveys, NFHS 1 and 2 were funded by the USAID in India with additional funds from UNICEF. The household survey sample was designed to cover over 99% of the country's population in 26 states. Following strict parameters of questioning, nearly 90,000 women were interviewed in local languages in different parts of India.
Experts and investigators together collected information on infant and child mortality rates, the health and nutritional status of women and children, contraceptive prevalence, the quality of health and family welfare services, and various related issues.
NFHS 2 adds a large data bank to NFHS 1. The combined information showing trends can impact future strategies for population, health, and nutrition programs.
As NFHS data was being collected, the population of India turned 1 billion. The billionth Indian, a girl, was born in 2000. In her world, girls still lag behind boys in education. But between NFHS 1 and 2, more girls are attending schools and consequently developing an increasing awareness about issues like the age for marriage and reasons for not marrying early.
मुलींचं वय पूर्ण नसतं झालेलं काही शरीराची वाढ अजून अपूर्ण असते त्यामुळे मग ह्याच्यानंतर जर लग्न झालं तर मग अर्थातच स्त्रीला सगळं सांभाळावं लागतं आणि तेवढे तिच्यात क्षमता उत्पन्न झालेली असते.
Nevertheless, change in the average age of women at first childbirth has been slow. Girls like Jhalibai are still married off at an early age. Jhalibai was barely 15 when she had her first child. Within this scenario, NFHS 2 shows changing trends which are significant for the new population policy. The number of women not wanting more than 2 children has increased within this decade, and 3 out of 4 women with 2 children want no more.
Health workers are witness to this change.
First, in the model service ல சார் தர்மபுரியில இருந்தெல்லாம் அங்க அப்பதிக்கு பாக்கும்போது 3 குழந்தை கண்டிப்பா வேணும்னு சொல்வாங்க. ஆனா இப்ப இருக்கிற பொசிஷன்ல 2 குழந்தை இன்னும் போனா 1 குழந்தை வேணும்னு சொல்வாங்க போல இருக்குது.
Sumati has only one 13-year-old daughter.
நாங்க முதல்ல ஒரு முடிவுல இருந்தோம். ஒரு குழந்தை ஆனா பொண்ணு ஒரு குழந்தை இருந்தா போதும். அத நல்லபடியா வளர்த்து ஆளாக்குனா போதும். அதனால நாங்க ஒரு குழந்தையோட போதும். இரண்டாவது குழந்தைய பத்தி நாங்க நினைக்கவே இல்ல.
One factor which makes it more difficult to reduce family size is the deep-rooted desire for paternal lineage. More than 80% of women with 2 sons want to stop childbearing, compared to 47% with just 2 daughters.
पर लड़कियां लेकर के हम क्या करेंगे? लड़कियां तो अपने घर चली जाएगी, फिर जस का तस। अगर लड़का होगा तो हमारा पीढ़ी तो जगेगा, गद्दी तो जगेगा। इन्हीं का जोर है। अब ये आ गए, अब भगवान को जिलावे तो ऑपरेशन कराना ही कराना है.
Social factors like son preference affect attitudes towards planned families. In the decade of the 90s, there has been a steady increase in the use of contraception, but only a small increase in the adoption of temporary spacing methods. Data shows the use of oral pills, IUDs, condoms has increased from 6% in NFHS 1 to 7% in NFHS 2.
Figures showing an overall increase in contraception reflect permanent methods like sterilization, which has increased from 31% of women in NFHS 1 to 36% in NFHS 2.
NFHS 2 shows there is a high demand for spacing among young married women all across the country. The use of oral pills or IUDs can increase if women, especially rural women, receive adequate information. In NFHS 1, contraceptive prevalence was at 41%. NFHS 2 shows 48%. But if all unmet needs are met, it can increase to 64%, which is comparable to many developed countries and would help India to achieve its goal of 2 children per woman.
There are various critical factors related to the issue of family welfare. Maternal mortality is one. Problems during pregnancy and delivery are major causes of death among women aged 15 to 49. One of the most important ways of preventing maternal deaths is to ensure that women give birth with the help of a health professional. Even today, more than half of deliveries are still conducted at home without any trained professional assistance. Vasundhara had her first child at home.
नाही म्हणजे 2 तासात झाले त्या म्हणल्या नाही जाय दवाखान्यात जीव आणली होती पण नाही गेलो माहिती होतं पण त्या म्हणल्या काय नाही धोका ते दाई असतात ना.
Many health workers and doctors believe that institutional delivery is a distant dream, but that safe deliveries assisted by a trained health professional is a plausible aim. While NFHS 1 showed that 33% of deliveries were professionally assisted, in NFHS 2 it rose to just 42%. Only the 3 states of Kerala, Goa and Tamil Nadu are close to achieving the national goal of 100% professionally assisted deliveries. But the national average drops because many states like Uttar Pradesh, Bihar and Madhya Pradesh are lagging behind with low coverage for safe deliveries.
Vijaya did have this baby in hospital.
சரி அதுமாரி தான் வந்து 2 பசங்களும் வீட்டிலே பார்த்துட்டோம் சரி இந்த குழந்தைக்கு ஆஸ்பத்திரிக்கு போய் பார்க்கலாம்.
எந்த ஊர்ல இருக்கற இப்ப நீ மட்டப்பூர்.
Antenatal and institutional care has shown only a marginal increase between NFHS 1 and NFHS 2. 1/3 of women receive no antenatal checkups, mostly because they believe these are not necessary. Obviously, many factors deter women from taking timely and correct health decisions.
When you ask a woman why she hasn't reported earlier, she will give you 100 different reasons why she has not. Sometimes a woman would say that I informed this problem to my husband, but he did not have enough time or inclination to take me to a doctor.
The neglect of a woman's health needs reflects her status within the family. And issues like domestic violence further compound such neglect. Data shows that at least 1 of 5 women has been beaten or physically mistreated after the age of 15, mostly by their husbands. Women seem to accept such battering as a part of their lives.
அடிக்கிறவங்க கூட எது காரணம் கேட்டு அடிப்பாங்க. அடுத்த நாள் சொல்லுவார் என் பொண்டாட்டி நான் அடிச்சிட்டேன் சண்டை போட்டுக்கிறேன் எதுதோ பண்ணிட்டுக்கிறேன் அப்படின்னு சொல்லுவார். அங்கே குத்திட்டுக்கிறாரு பார் அடிச்சுட்டுக்கிறேன் கைத்தால குத்திட்டுக்கிறாரு ஒரு நாள் எங்களோட ஓடிட்டு நான் போனா நம்ம குழந்தைங்க 2 வச்சு நம்ம ஓட்டு என்ன பண்ணுறதுன்னு போக மாட்டேன் எங்கேயா.
In a way, the survival of their children has motivated women to lean towards the health delivery system.
म्हणजे आता पूर्वी कसं होतं जेव्हा आम्ही काम करायला सुरुवात केली ना तेव्हा जर समजा एखाद्या गरोदर बाईला जर सांगितलं की तुम्ही तपासायला या किंवा तुमच्या मुलाला ट्रिपल पोलिओ घ्या तर ऐकत नव्हते. परंतु आता ह्या 10 वर्षामध्ये तो काळ जवळजवळ 12 ते 13 वर्ष गेले त्यांनी आमचं ऐकलं नाही. परंतु आता स्वतः होऊन त्या उलट विचारतात आणि जे मी सांगल किंवा बाकी कुणी सांगितलं तर त्या ऐकतात. गरोदर बाई तपासणी करून स्वतः घेते मुलाला ह्या ज्या ट्रिपल पोलिओ BCG ह्या लसी अगदी न सांगता घेतात म्हणजे.
The universal immunization program had a nationwide impact. NFHS 1 showed 30% children received no form of vaccination. This declined to 14% in NFHS 2. The Pulse Polio campaign has also met with considerable success. Yet 1/3 of young children had still not received the recommended 3 doses of polio by the time of the NFHS2 survey. Some states lag far behind. For instance, in Uttar Pradesh, 1 of 3 children has received no vaccinations at all. Data also shows that much needs to be done because dropouts before the 3rd doses of DPT and polio are high, and coverage for measles protection is still low.
At the same time, though there is an evident decline in infant mortality, there are dramatic variations at the state levels. Infant mortality is especially high in the major states like Uttar Pradesh, Madhya Pradesh, Orissa and Rajasthan. One is faced with sad figures. They tell us that 1 of 15 children die before their first birthday.
A major component of this infant mortality of the first year is the neonatal period in the first month of life. And out of the figure which we quote, 60% of the contribution comes from the neonatal period. So if that particular period, the basic neonatal care is improved, the major neonatal problems like asphyxia and infection are properly tackled, I think there will be a significant drop in this infant mortality.
Though the national goal is to reduce infant mortality to below 30 by 2010, the national IMR has moved from 79 in NFHS 1 to 68 in NFHS 2. Only unfailing efforts in child survival programs can change these trends.
The foundations of health are so fragile, every aspect needs attention. The physical and mental development of many children is compromised from infancy. Less than 60% of infants today are exclusively breastfed in the first 3 months as recommended, and 2 out of 3 infants do not receive timely supplementary foods at the right age.
तसलं काय नाही देते वरचं दूध पाजी त्यात अंगावर पाजी त्यात हे आपला तसं काय नाही हाताने खायना बिस्किट तरच देतो आम्ही खायला तवर नाही.
Malnutrition is widespread and most serious among young children. While NFHS 1 saw 52% children underweight, NFHS 2 found 47% are still underweight. The survey also shows 74% children are anemic. The battle of caring for children begins with the mothers. Weak mothers are more likely to have weak children. Apart from general malnutrition, anemia is one of the most critical aspects of women's health.
Anemia in any area, whether it is rural or it is urban, will lead to miscarriages, will lead to preterm deliveries. And later on, these preterm deliveries can create problems with the infants and anemic children also.
While 36% of women suffer from undernourishment, specific hemoglobin tests in NFHS 2 have shown that 52% of women are anemic.
Confronted with such major concerns of maternal and child health, HIV/AIDS seems quite apart as an issue. But studies show a substantial rise in infected people within a decade. Preventive efforts focus in danger zones like truckers on highways, where the likelihood of infection carriers is high. With at least 3.5 million infected people in India today, HIV/AIDS is a major public health challenge. NFHS2 data shows that television is the most important information source on AIDS among women who have heard of the disease. The majority of women, however, have no regular exposure to television, and the national level of AIDS awareness among women is very low. Only 40% of women have heard about AIDS. Among these, 1/3 do not know any way to prevent AIDS. While some states like Tamil Nadu, Mizoram and Manipur have a high awareness of up to 93%, in Bihar, only 12% of women have ever heard of AIDS.
With the 1 billion population growing continually larger, there is urgency. Today, with the fertility rate of about 3 children per woman, India's population will be about 2.5 billion in 2050. Just 1 child less per woman could bring the figure down by 1 billion. To help achieve the goal of 2 children per woman, the NFHS data bank indicates trends on all population-related issues.
By fully responding to unmet needs, especially among young married women, contraceptive prevalence can be raised from the existing 48 to 64% to help achieve the goal of 2 children per woman. The national average of 42% professionally assisted deliveries needs immediate attention to match the goal of 100%. With 2 out of 3 children still not receiving timely supplementary feeding, figures of underweight and anemic children can decline by addressing attitudes in infant and child feeding practices. Much needs to be done because dropouts for DPT and polio are high and coverage for measles protection low. Raising AIDS awareness is a critical challenge with 3.5 million HIV/AIDS infected people and low awareness levels among women.
India is the first country to have adopted a national family welfare program. By developing appropriate strategies to implement the new national population policy, the foundation of a widespread operational health delivery system can be strengthened with the NFHS data bank.
और जुकाम और क्या बोलूँ और क्या बुखार तो